Welcome back. I'm here with Dr. Brett Schneider, and we're cutting through media and marketing spin in plastic surgery. So Brett, before we get in, I know you're in a great practice in North Florida. Tell us a little bit about your practice there in Ponte Vedra Beach.
Well, our practice is called Ponte Vedra Plastic Surgery. It's based in Ponte Vedra Beach, but we have offices all over the greater Jacksonville area. There are a group of 4 of us. All of us come from different backgrounds. I think all of us bring a little something different to the practice. And, you know, group practices have real advantages for patients. We have our own freestanding surgery center. We have anesthesia there every day. We're able to provide some of the latest technologies because as a group we can afford it. And, you know, at the end of the day, being able to get along with other plastic surgeons should say something to patients about the ability to work cooperatively towards a common goal. So I like the group practice setting. It's certainly not for everybody. I think it brings real value to our patients.
And I know all you and your partners, and you're all great guys, but you guys have a website, correct?
That's
and
correct.
And you use other media and online tools to help market the practice and allow patients to be educated and learn about your practice, correct?
Correct.
So, I mean, I think that what we want to talk about is both how it can be used productively, but also, you know, I'm shocked sometimes looking at online content and the schemes and marketing that's done online that is just unethical in a lot of regards. So the question is how patients and our viewers can cut through all that to get reliable information. So we're gonna look at a few of these different sites, and I'd like you just to comment on their value to patients. So let's first talk about the gossip sites, awfulsurgery.com, famousplastic.com. Where do you see those fitting in for patient use?
They're really not very useful to patients. It's really more of a freak show type scenario where you have famous people who unfortunately and very sadly have poor plastic surgery outcomes or significant complications. So, you know, they're scary. You know, unfortunately they do cause some patients to form negative opinions regarding certain procedures. And ultimately, the problem of being a celebrity is you're in the public eye, and that's good. And sometimes if you have bad plastic surgery, that's not so good because unfortunately your image and your complication is paraded out for everybody to see. But I try to discourage patients from really forming strong opinions about the utility of procedures based on those kinds of sites. And a lot of times I sound like a broken record when I say it's not the procedure, it's how it was done. And not everyone has a great result.
Let's move to sites like makemeheal.com, realself.com, implantinfo.com, where patients are posting their experiences with, say, a certain physician, and patients will go on those sites and read about those doctors. Do you think, is that a good way for patients to make a decision about picking a surgeon, or should they really be looking at more objective criteria for that surgeon's credentials?
There's lots of ways to judge a surgeon, and obviously by word of mouth. Obviously it's very important when you go meet with a surgeon to make sure that you have a good rapport with them. The sites that have ratings of surgeons and other doctors, they have some value, but again, patients have to have a skeptical eye. We all know that every surgeon, no matter how good and how experienced they are, have some poor outcomes. We all know that surgeons have their big fans and their detractors. And all of us experience that during the course of a career. And it may be that a surgeon has 2 or 3 negative comments on a site, and that surgeon may be one of the very best surgeons in that particular field, but maybe takes on more difficult cases. On the other hand, if you're thinking about going to a surgeon and you see 30 or 40 negative comments, it's certainly worth speaking to that surgeon about. If you still want to go see him, ask him. If that person has confidence and integrity, they're going to be able to give you a good answer about that and perhaps not be quite so defensive. So I always tell people, look, do your homework, look at as many different sources of information as you can, but at the end of the day, it's all got to be taken with a grain of salt.
Yeah, once again, doing your homework's incredibly important for the patients to do their homework.
You know, a surgeon's credentials are very important. Where they train, are they board certified? Are the facilities where they're working properly certified by the appropriate agencies? But, you know, not everybody who trained at Harvard is going to be a great surgeon. And so these other points of information or sources of information are very important for patients to consider. So you can't just go purely on training, although that's an important starting point. You've also got to get your own sources of information, and nothing replaces a very thorough consultation with the doctor.
Yeah, I totally agree. And, I think the other important point is that there's no magic bullet for this. You probably need to take pieces of information from many different things. And actually the sites, I've found some of the patient review sites to be fairly helpful because, the reality is that good doctors tend to continue to do good procedures and have many happy patients. And if you see consistently that people are happy with things, I think that gives you some information. It's not the end-all, be-all, but it is good information.
Absolutely.
So let's shift a little bit to this whole realm of social networking, okay? Facebook, Twitter. I don't even know what Twitter is exactly, but do you tweet?
Well, I'm on Lance Armstrong's Twitter page, so...
You're probably the only plastic surgeon he allowed on there, 'cause the only one fast enough to keep up with him. But so you have somebody in your practice named Adrian, who specifically manages all of your marketing and social networking for the practice. And through the magic of the internet and Skype, we have Adrian with us here today. Adrian, it's great to see you and to have you give us some insight into what you're doing for Ponte Vedra Plastic Surgery. Can you tell us a little bit about how you're managing the social network for the practice?
Hey guys, thanks for having me on today. At Ponte Vedra Plastic Surgery, we are able to connect with our patients through Facebook, through emailing our patients directly. We also do special events. Sometimes we use Twitter, constantly be in the face of our patients and let them know what's going on, what's the latest news, what are trends going on, and also educating them so that they know what's safe and what procedures they maybe shouldn't do or what should they be interested in. We do get a lot of questions through our website from patients. They email our website all the time with questions about particular procedures or things if we offer that. We also have a blog on our website, and so patients are able to kind of dialogue with us and the doctors through the blogging, which is so popular these days. People want to see what the doctors are saying and what the doctor actually thinks about some of these procedures. And so we're able to do that through our blog and then also through our email address and the contact us form on our website.
What are the dangers of non-board certified plastic surgeons using these same tools to market their practice? Can people be misled?
I think as a patient, they have to be very careful what you're reading online. The old wives' tale says, you never believe what you read online, and sometimes that's true. Other doctors are offering procedures, and they are using very tricky marketing schemes. They're using before and after pictures that aren't theirs or have been retouched. So you do have to really be careful when you're on Facebook and you see that advertisement on the side. And is that really real? And that is something that patients do need to be aware about. We like to consider ourselves a trusted source for information, and so when we are answering those questions, we're giving honest answers. The ads that we run on Facebook are so that our patients are aware of good things out there, and it is a form of educating them and constantly having a good message in front of them. But in today's market, you really do have to be careful. You really never know who's going to do a procedure and what kind of credentials they have in order to be able to do those things.
Thanks so much, Adrian. It's been great having you on.
Well, Adrian's terrific. She's doing a great job for her practice, both with the social networking and with all the marketing work that a group practice requires. It's interesting if you think about the social networking because, in reality, plastic surgeons and other doctors have always depended upon word-of-mouth referrals. And in reality, in the old days, plastic surgeons developed a social network where their patients talked to their friends, and then those patients and those friends became patients, and it really formed a network. And so the idea behind social networking is really to allow more people to be brought into that network and to give them more information and more lines of communication with the practice. So we're real excited about that.